Hello and welcome to Coastal Payroll Services Webcast on the Patient Protection and Affordable Care Act. Today we'll be talking about the Employer Shared Responsibility Mandate. As many of you have heard, effective July 2nd, 2013, the current administration has pushed out the enforcement of the Employer Shared Responsibility Mandate to 2015. So that has provided some breathing room for small businesses as they evaluate their compliance efforts and how they will respond to the Employer Shared Responsibility Mandate. So today we thought it'd be useful to inform you about what the mandate means and how you determine if it affects your business. Because even though the compliance has been pushed out 1 year, we are recommending to our clients that you really start to evaluate if this will affect your business, and if so, what steps you'll need to take to ensure that you're in compliance. At Coastal Payroll, we have an ongoing initiative to understand the Affordable Care Act and all of the different components of the law to adapt our service offerings to provide enhanced services to our clients to ease the administrative burden of complying with the Act, and to connect our clients through ongoing updates such as this to keep them informed about the new laws and the regulations and how they affect our clients. So let's talk in more detail about the Employer Shared Responsibility Mandate. The first step is understanding if it affects your business, and the way to do that is to calculate the number of full-time employee equivalents that you have. If you have less than 50 full-time employee equivalents, the Employer Shared Responsibility Mandate will not apply to your business. If you have 50 or more full-time employee equivalents, it will apply to your business and you will need to comply with it. And the important thing to know is this is going to be an ongoing measurement. So even if your business has less than 50 employees in the beginning, you will be required once the provision takes effect in 2015 to consistently monitor your business to ensure that you are below the less than 50 so that you do not have to comply. So if you have 50 or more employees, the Employer Shared Responsibility Mandate will apply, and it means that you must provide affordable and minimum value health insurance to your employees. So the good news is Coastal Payroll Services has an Affordable Care Act report that can help you to calculate your business size. So contact us at any time and we can run that report over any period that you define, and we'll be able to provide you with your number of full-time employee equivalents on a monthly basis and over the span of the entire period. So really quickly, we'll explain what goes into the calculation of the business size. The first step is to count the number of full-time employees that you have, and the definition as defined by the federal government is if the employee works on average 30 hours or more per week, then that is a full-time employee. So you count the number of those employees, then we'll calculate the number of full-time employee equivalents. And the way to do that is to take all those non-full-timers, aggregate all of their hours that they worked over the month, and divide that by 120. This will give you your full-time employee equivalents. We'll add steps 1 and 2 together, your full-time employees and your full-time employee equivalents, to get the total number of full-time employee equivalents that you have, and subtract the number of owners from that total. If that total exceeds 50 full-time employee equivalents, then the Employer Shared Responsibility Mandate will apply to your business. So when we run that report, we'll have our clients define a measurement period, and that measurement period can be as little as 1 month, but it's recommended that you evaluate your employer size using a consecutive 6-month period. And for most of our clients, we've been running that report in 2013. We just started running it for a lot of clients for the first 6 months of the year. Mandated insurance must be affordable minimum essential coverage. So what does that mean? Well, affordable means that the total expenses that are paid by your employees must not exceed 9.5% of their total household income. There are a few safe harbors to help determine what 9.5% of total household income means. We'll talk about those in more detail in a later presentation. But the key theme here is to understand that if you provide health insurance to your employees and you're deducting their portion of the insurance from their paycheck, it shouldn't exceed 9.5% of their total household income. The coverage must also be minimum essential coverage, which means the plan must cover at least 60% of the total allowed cost. It'll be important to work with your benefit broker to ensure that you select a plan that meets the minimum essential criteria. So, what does lack of compliance mean to employers in the form of penalties? Well, there are two ways that you must comply. You must provide coverage, and if you don't do that, then you'll have to pay a penalty for each employee. So if you provide no coverage and you're required to, which means you have over 50 full-time employee equivalents, then you'll be required to pay a penalty of $2,000 per employee per year. You will receive an exemption on the first 30 employees, but no coverage means $2,000 per employee per year. If you provide coverage but it's not affordable or it's not minimum essential, and one of your employees or one or more employees go to an exchange and obtain coverage there instead, and they receive a federal subsidy, and it's determined that your coverage is not affordable or it's not minimum essential, then you'll be required to pay a penalty of $3,000 for each of those employees that goes to an exchange. So there are two ways that you'll be evaluated and two possible penalties that businesses must pay. Some other considerations to keep in mind are waiting period. Waiting period is a period of time before eligible employees must be enrolled. Federal government has stated that that period cannot exceed 90 days. In states like California, that period is even shorter. It's 60 days. Auto enrollment, if you have over 200 full-time employees, you'll be required to automatically enroll those full-time employees in your coverage. And then there are considerations for seasonal and variable employees. So in calculating your business size, if you do have a number of seasonal or variable employees, there are some calculations to help factor those in determining if you really meet the 50 full-time employee equivalent threshold. So that's a quick overview of the employer shared responsibility mandate. We've talked about how to calculate your business size, the measurement period that you can use when calculating the business size. We've talked about what affordable and minimum essential coverage means, what penalties will apply to your business if you don't comply with the law, and some other considerations to keep in mind. At Coastal Payroll, we're helping our clients by providing the business size and the affordability calculations. We've got an Affordable Care Act report that we can provide to our clients at any time, so please reach out to us if you need that report. As the federal government more clearly defines the reporting that will be required to the various agencies, we will be providing that reporting and ensuring that our clients report that on a timely basis. And then we'll also be providing ongoing compliance updates, such as this webcast. So we'll have some upcoming webcasts on the notice of exchanges and subsidies. That's going to be required effective October 2013. We'll also have a webcast on our Affordable Care Act reporting and helping our clients understand the reports they'll receive from us. And we'll continue to provide ongoing updates through our social media and our website. So stay tuned for more updates as we continue to keep our clients informed about the Affordable Care Act and its wide-ranging provisions on small businesses. Thanks for your time today.